As of right now, it is still really too early to know long-term impact. I mean, this is something that we're just going to be realizing, as the months and the years go by. But the prediction is that we will see more cancer diagnoses now, because they did go down during the pandemic because of the screenings. When we do see patients, they are likely going to be a more advanced diagnosis. Um, and also, there may be increased mortality. I mean, for a long time in cancer, we've had not had an increase in mortality. We've always either remained stable or we've had a decrease. So now we're expecting to see an increase. Hopefully, we're wrong, but time will tell to, help us sort through all of that.
Well, and yeah, that's a very sobering, report. And we see the same, thing at Cancer Care Services, and the screenings, that um, how that will impact when people do eventually, that doesn't mean cancer stopped in 2020. It just means it wasn't diagnosed in 2020. And so when folks do receive that diagnosis and they hear the words, you have cancer, and they learned that their cancer has progressed, which makes it more difficult to treat, as you said, and possibly affects whether or not they're able to survive their cancer. Um, that brings so many um, additional emotional needs and the financial needs of the pandemic and job loss. And at Cancer Care, we created a special emergency fund last year to help patients with rent and groceries and things that we just never had to do before. But the need was so profound, we had to just jump in and do whatever we could. So um, I'm glad that. I hope, I should say, that now that screenings are back up, that everybody who's listening to this webinar, if there's something you've been putting off, a trip to the dermatologist or your mammogram, now is the time. Please, please, please take care of yourself and get out there and be screened.